students, it's Dr. Tatum again. I'm really sorry. I thought the last recording would be my last lecture on this content, but obviously not. I just must like to talk way too much. So the last few things that I wanted to point out to you about a prolapsed umbilical cord is under management and how we reposition mom in order to get pressure off that presenting part or the cord itself. And so if we look on slide 42, it will tell us the different positions that might be best for mom. So if you look at letter A here, this shows a baby that is in vertex position. And here you can see the nurse or doctor with a sterile glove on, pushing that head upward off the cord itself, which is the presenting part. B would be for a baby that's in a breech position. So here they're putting pressure on the bottom of that baby in order to relieve pressure on that cord itself. And then letter C just shows mom in a more modified Sims position. She's on her side with her hips elevated, and you can see that is actually relieving that pressure on that cord itself. And then D, you can see that mom is more in a knee chest position here. And again, that's going to be very, very beneficial too to relieve pressure off of that cord. So again, I want you to think about what you're going to see on the fetal monitoring strip if a baby had, in fact, a prolapsed cord. Think about anything that could cause cord compression. And we know that cord compression is going to cause a V almost or a deep U shape on the fetal heart tones. So just be aware of that. And then the last disease process I'm going to talk about is a ruptured uterus. And so a ruptured uterus can be very, very serious for both mom and baby. If this happens, it could increase mortality rates in both mom and babe. And so we try to prevent a rupture from occurring if possible. There are lots of different risk factors associated with a uterine rupture. But first, let's try to visualize what it is. When a uterus actually ruptures, it means all layers of the uterine wall break open and give way. And so when that happens, if you kind of think about really what this picture is presenting, you can see all layers of that uterine wall are broke open. And now that baby can slide out of the uterus and can actually go into the abdominal cavity. So it can be very scary. Mom is going to be hemorrhaging. Mom's going to be losing a lot of blood. And so pay attention to her vital signs. Although you may not see blood initially, she's going to be in hypovolemic shock. And so make sure that you're watching for those signs and symptoms. So think about what her blood pressure is going to be doing. It's probably going to be tanking. She's going to be very hypotensive. She's going to be tachycardic. She's probably going to become unconscious. So again, watch for those signs and symptoms that we've talked about throughout the past year, it seems like, with hypovolemic shock. So really that uterine cavity just splits open. That's basically what it is. So some of those risk factors would be a trial of labor for a VBAC. A VBAC stands for vaginal birth after cesarean section. So if a mom had a C-section with her first baby and she wanted to try labor, with the second, she has a higher chance of a uterine rupture. Although it's rare, I will say the percentage rate is pretty low that it would happen. It can happen. And so just that area where the C-section was performed, that area of the uterus might be a little bit weaker in nature. So that scar tissue can make it weaker and more thin. And sometimes that's when a uterine rupture could occur. Inductions, anytime there's an induction, there's always that chance, especially if we're using oxytocin, especially if we are using a lot of oxytocin on mom. Any congenital uterine anomalies, prior uterine surgery like C-sections like we talked about, or any other procedures. Multiparity, and also trauma. So think about just trauma in general, maybe a motor vehicle accident, it could be battery, it could be a fall. So all of those things. I think about domestic violence almost if somebody hit mom really, really hard in the abdomen. Sometimes that can occur. All right, let's move on to the next slide then. So signs and symptoms of a ruptured uterus. A lot of times mom is going to have lots of abdominal pain and tenderness when this occurs. You might see vomiting, syncope because her blood pressure is going to be tanking, vaginal bleeding, tachycardia, pallor. You're going to see changes in fetal heart tones. You're going to see probably just prolonged decelerations. And then uterine contractions might stop as well. So specifically a non-reassuring fetal heart rate tracing is probably going to be one of the most common symptoms to be assessing for. Also loss of fetal station. So if babe slips out of the uterine cavity into the abdominal cavity, that's when you're going to see loss of station. And then signs of hypovolemic shock. Prevention is going to be the best treatment if at all possible. And that's just really relies on a lot of education. So if she tries to VBAC after she's had a C-section, she needs to know the risks involved. As far as surgical intervention goes, they might try to repair the uterus as much as they can, but if there's been a lot of bleeding and they can't control the bleeding, then most likely mom will be having a hysterectomy, which can be very sad. The big thing is this does really increase mortality rates, and so it wouldn't be surprising if she had to have a hysterectomy if this occurred. All right, so that is all I'm going to really stress in this recording. Please read through the amniotic fluid embolism. I think that although it's rare, I want you to look at it and just be aware of what an amniotic fluid embolism is and what can occur if it does happen. All right, thank you for bearing with me. I know this was a very long chapter, so please come with any questions when I will Zoom with you on Wednesday. All right, I appreciate your flexibility and I'm thinking of you all. All right, have a good weekend.